Hi, good evening, everyone. So firstly, I would like to thank the Secretariat for this invitation to speak at the 10th Malaysian Hybrid Conference on Healthy Aging. So it's a pleasure for me to share some information and some research work that has been done in the area of brain food. So the title of my presentation today is Brain Food, Eat Your Way to a Better Memory. My name is Satvinder. I'm from UCSI University. This will be the outline of my presentation. I will touch a little bit on the brain development, a little bit on the memory, the dementia risk, nutrition for the aging brain, what are the important nutrients that we talk about when we talk about aging brain, and what's the future for a healthy brain development. Now, we are seeing a growing life expectancy. So what you see on my screen now is basically the life expectancy that we see in Malaysia. Now, in Malaysia, if we look at the projection up to 2050, we are seeing that it's a steady increase of age. We are looking at 80 years mean life expectancy for Malaysians. Now, as one ages, there are a lot of age-related neurodegenerative conditions too that may take place. Now, this will definitely increase the societal and the emotional costs, whether in the country, individuals, community. So there are a lot of stakeholders' role that we have to look into when the growing life expectancy increases. Now, this is not the scenario in Malaysia. This is definitely a worldwide changes that we are looking that we are going to see. Now, what you see here is a projected from the Department of Statistics Malaysia, whereby we can also see that male and female, they are going to live longer from 2014 to 2020. So we are seeing that from 2014 to 2020, people are living longer once they hit 60 years old. So we are looking at men living up to late 70s and women early 80s. Now, with growing life expectancy, there comes a lot of comorbidities and health issues that we need to tackle to ensure the concept of healthy aging. Now, they should not be burdened with illnesses or diseases. So today, my focus is mainly on brain development. Now, our brain is developing until we are 30 years old. And this development is rather unique, whereby it has many factors that influences the development. We have genetic factors, the endogenous, what is internally in our body, and the environmental factors as well. So there's a lot of interactions, a complex interplay that we look into these main factors. Now, since brain development is rather slow in a way that it slows in terms of its nature, there's a lot of window of opportunity for us to slow down the progression of any negative consequences to brain development or brain function. Therefore, we are fortunate, or we can say that there are many factors that we can play around with this. So let me bring you to the main stages to healthy brain aging. Now, when we look at child to adult, so this is where the most important concepts of brain development is more onto the maturation and the development, from infancy towards young adulthood. Now, from this point of adulthood to elderly, we are looking more at the maintenance of its function. How do we maintain the function of brain that it doesn't regress? It doesn't regress further, and it can be at its optimum function. So here I will bring you to the attention that we look about when we look at the elderly population, which is dementia and Alzheimer. Now, basically, dementia and Alzheimer is a concern when you talk about memory, aging, brain aging. It's been seen that there's a high prevalence among the elderly and the aging population. Now, if you can see in the Europe side, the dementia percentage, the incidences is increasing quite rapidly as well as Malaysia. More and more people are being diagnosed with dementia from 2015 to 2050. This is the projection. So we can say that it's a double increase. Now, when the concept of dementia or Alzheimer comes into the population, there's a higher cost. So people living with this condition may be as close as 50%. So how do we manage it? How do we halt the progression of these conditions? Now, there are many factors, as I've mentioned earlier, but the factor that I would like to focus on today is more on in nutrition. So the improved nutrition is a promising factor to reduce the risk of neurodegeneration and dementia in elderly. Now, besides that, the NCDs and its role in cognitive decline is well established. When one develops obesity at midlife, it will tend to be an important risk factor for late life dementia and cognitive impairment. So this is one issue that needs to be tackled, and reducing the incidences of NCD in the population. Now, why does obesity leads to cognitive impairment? Is basically it's mostly associated with inflammation and neuronal degradation. As we know, in an obese individual, they have high levels of C-reactive protein, an inflammatory marker, and this could lead to brain atrophy, lower in the gray matter, and the total brain volume. Now, other comorbidities that leads to decline in cognitive function is the hypertension, dyslipidemia, insulin resistant, as well as type 2 diabetes. So basically, if you look at the literature, obesity and type 2 diabetes have been seen to increase the risk of cognitive impairment as high as 65%. Now, in a normal aging, so we look into our cognitive status. So we have the cardiometabolic risk factors. We have issues like anemia, oxidative stress, neuroinflammation, and autophagy and AMPK signaling. So basically, we look at pathological aging. Aging is a definite process that each and every one of us would go through. But when we look at the lifestyle intervention that has been done and how it can kind of like delay or maintain, the concept of the healthy brain development or healthy brain function. So we can see that a lot of factors are related to our lifestyle as well as the nutrients that we take in our diet. So I'll move on to the next part of my talk, which is on the nutrients for a healthy brain. Now, omega-3 fatty acid is a very popular nutrient in many reduction of many NCDs or issues with health. As we know, the EPA and DHA is an important factor or important composition in the brain development, even from young children when we talk about. And EPA and DHA, why is it important for an aging brain? Even it reduces the brain inflammation and preserves the integrity and function. So many studies have shown a positive association, making omega-3 actually an important nutrient for preventive measure, not treatment. It's more of a preventive measure whereby it helps to prevent neuroinflammation and reduces the risk of memory decline. Now, I'd like to bring attention to a study called VitaGOG, which is a randomized trial. Now, VitaGOG was done among 266 individuals who were more than 70 years old, and they were already diagnosed with mild cognitive impairment. Now, after this trial, which went on for 2 years, and they are separated into two groups. One is the placebo group, and the other is a group that were given high doses of B vitamins. Now, high doses of B vitamins. So what was done in this VitaGOG trial is basically they also assess the baseline omega-3 status of the individuals. So they have grouped them into low tertile to the highest tertile. Now, if you can look at the bar graphs that I've shown here, those with a higher omega-3 fatty acid tertile from baseline supplemented with high dose of B vitamin showed best results in episodic memory, in their global nutrition cognition score, and as well as cognitive decline score. So they had the best outcome, which means that higher baseline omega-3 fatty acid improve cognitive and clinical outcome when they are supplemented with B vitamin over a 2-year intervention. So improving omega-3 status could actually help in other supplementation interventions as shown by this VitaGOG trial. The other nutrient of concern is the flavonoids. So basically, flavonoids are promising agents that results in the improvement of memory. It has a lot of beneficial effect in its role of improving peripheral vascular function and blood flow. Foods such as orange juice and coca flavonols have shown to improve cognitive function, and this may be increased to its function in improving blood flow in the brain. So these are some examples of foods that contains high level of flavonoids. Another important substance or function of food, functional food, we can say an important compound is called the dietary polyphenols. It has been well established that it protects against CVD, diabetes, cancer, osteoporosis, and even neurodegenerative disease. Now, in a study whereby it was done in a 3-year follow-up, older adults that were not diagnosed with dementia and they consume a rich polyphenol diet, they had a reduced risk of cognitive decline. So we can see that the polyphenols actually helps a lot in prevention of oxidative stress, which preserves the brain function and reduces brain damage. So it has a lot of neuroprotective effect. Now we go to the role of micronutrients. So micronutrients are very important in many aspects of health studies. You can see in terms of prevention. So it also plays a very important role in brain protection. Mainly 3 main micronutrients that I would like to emphasize here is zinc, selenium, and chromium. So studies done looking at decreased in plasma selenium, they showed that these individuals had higher probability in cognitive decline. And these pictures that I've put here, these are basically foods that are high in selenium content. Insulin resistance too can be attributed to chromium deficiency, and this leads to increased of oxidative stress in an individual. So increasing supplementations in chromium can actually improve not just glucose metabolism, but they can also have better cognitive function. Okay, so in this slide, I would like to show that there are 2 vitamins here that are of interest. Okay, the B vitamins, which I've also explained previously. Basically, in terms of B vitamins, the folate reduces the dementia risk greatly. Because of those who have high homocysteine supplemented with B vitamin, they can actually reduce their cognitive decline. Now, in a longitudinal aspect, there are a lot of findings and they are not very conclusive that B vitamins alone can improve the function of cognition. Now, in terms of vitamin D, this is a growing nutrient of interest of recent years, and it has been seen that in meta-analysis that done, so 37 studies were looked into, and they saw that in these 37 studies, those with lower concentration of vitamin D among Alzheimer's disease patients, they actually had lower vitamin D level as compared to those without Alzheimer's. So 70 to 90% of older adults with cognitive decline have low levels of vitamin D. So if you look at this mechanism of how vitamin D actually helps in cognitive decline, what you can see in the start here, these are basically the role of vitamin D in ensuring the preventives towards cognitive decline. And we can see that they actually play at least 7 roles in its contribution to declining of cognitive function. Right, so let me bring your attention to another trial called the Lipid Diet RCT trial. So Lipid Diet was done among 311 subjects who had prodromal Alzheimer's disease. So these individuals received a drink of 125 ml of drink with multi-nutrients. And what are the multi-nutrients are shown over here. So it's a compounded drink that are given to all these individuals for a period of 2 years. So they need to take in this drink once a day. Now they showed that those who were on this drink for 2 years had a slower progression towards of Alzheimer's disease because they're already diagnosed with Alzheimer's at the start of the trial after 24 months. So in terms of final outcome, while there is no significant difference in terms of the cognitive measures that were done, however, they could see the progression was rather slower in the trial group. And from this study, it was suggested that prevention is much better approach to halt the progression of Alzheimer's instead of treating patients that are already with Alzheimer's with nutrients, multi-nutrients intake. Now, I'd like to bring you to another interesting diet called the Mediterranean diet. So basically, the Mediterranean diet consists of diet that are more plant-based, high in olive oil, mufa oil, and have high to moderate to high consumption of fish and seafood, and they have limited consumption of butter or dairy products and red meat and white meat. So they focus more on seafood. So what was seen in a Mediterranean diet is its role in reduction of reactive oxygen species, and this has more neuroprotection. So Mediterranean diet is a very famous diet even in CVD prevention, diabetes. So it has a very promising outcome. And there's reduced oxidative stress and inflammation, improving its antioxidant defenses. How Mediterranean diet as well work is in its anti-inflammatory gut bacteria role. So it contains more pro-inflammatory bacteria. So they can see that this consumption of Mediterranean diet can help improve or colonize the gut with a good bacteria. So looking at the randomized control trials that were done on Mediterranean diet on cognitive function, so we can see these are two large studies that were done for a period of time. So PREDIMED is a large cohort that was done among individuals aged 55 to 80 years old, and they were followed up after 6.5 years. So there were a total of 447 elderly that participated in this PREDIMED intervention trial, whereas New Age study consisted 65 to 79-year-old healthy elderly, and they were followed up for 1 year. There were a total of 1,279 subjects that followed up. Now, what is the composition of these two trials? So basically in the PREDIMED, they gave the description of a dietary pattern to the subjects, and they provided them with seasonal shopping lists. So these were all monitored or handled by nutritionists, dietitians in the team. So they were also given meal plans and recipes to all the subjects. Now, in addition to the nutritional advice they were given, subjects were also given a free portion of either extra virgin olive oil for 1 liter per week, or they were given an option to choose unprocessed mixed nuts. So in the form of walnut, almonds, and hazelnuts, trying to give in more focus on monounsaturated fatty acids. Now, in terms of results, we can see that the subjects that in the PREDIMED study, they had improved cognitive function in those who were in this trial compared to the group that were given the low-fat dietary pattern. So this showed that promising influences of Mediterranean diet on cognitive function. Whereas in the New Age study, so this was the component of their intervention, they were advised on how to collaborate or include these healthy food groups in their diet, and they were given the portion sizes as well as the frequency of the consumption per week. Now, they were also advised to reduce the consumption of alcohol, salt, and sweets. Now, in terms of results, those who adhered greatly to the Mediterranean diet had a better improvement in their global cognition and episodic memory as well. So when we look at future approaches, what is in the future when we look into the studies of aging brain? So microbiome offers a very promising future, I would say. So the gut microbiome is gaining a lot of interest because the gut brain axis that has been shown to have a better cognition outcome. So manipulating the gut microbiome towards healthy aging, including diet, exercise, pro or prebiotic. Fecal transplant too is the current or the in thing at the moment in terms of looking at cultivating or colonizing the gut microbiome. So this could offer longevity from aspects, yeah, and it can also prevent the neurodegeneration. So probiotic, prebiotic, and postbiotics are also important in the research or in the area of healthy aging or healthy aging brain. The three main mechanisms of how these compounds actually help is in its role in immune system, how its role from the diet, from bacterial fermentation, and the vagus nerve connecting gut to the brain. So they have seen therapies that shows very promising outcomes. Psychobiotics is another future or another area that we can see more influences of neural health via the release of neuroactive compounds. So with that, I like to end my talk. So thank you for your attention.